Hello viewers. Today let's talk about a very common and most painful condition that most of our patients face, and that is a toothache, severe toothache. So this is one of the most important dental emergency that we come across every day. So at least daily couple of patients come to our clinic with a complaint of severe tooth pain, unbearable, I could not sleep at night. And let's discuss what is the main causes of these toothache and what are the treatment options. Hi viewers, I am Dr. Suhas, Chief Dental Surgeon, oral implantologist based out of Eledent Banjara Hills. So we have branches at Kondapur, Kukatpally, Manikonda and Banjara Hills. So let's dive into it. So what are the most common causes of tooth decay? So toothache is mostly, it could be due to a sensitive teeth. So enamel has worn off and your dentine is exposed. Continuously eating hot and cold substances are continuously irritating your teeth, and that will lead to inflammation of your pulp at the center of the teeth, and that is one of the most important cause for tooth decay, tooth sensitivity. And in such cases mostly root canal is the treatment option. Next, it could be a gum related disease we call periodontitis. It could be chronic periodontitis. Dull aching pain for more than 6 months is chronic periodontitis, and acute sharp shooting pain from few days to few weeks could be acute periodontitis associated with aggressive bone loss. So here generally flap surgeries are recommended. Tooth cleaning, root planing is the way to go about it. But if tooth is also involved, there is a decay, then root canal is also recommended. Next, the tooth pain could be due to impacted teeth. So impacted teeth is nothing but your wisdom teeth, which is not coming out straight and going and hitting your teeth, bone and soft tissue, causing abscess in pus formation, swelling, and people come with wisdom tooth pain all the time. So here the wisdom tooth has to be taken out. So there are different types of impactions which are there. So it is covered in another video. You can check around for impacted teeth wisdom tooth removal. If you could check out, you will find out about it. Next, it is inflammation inside the tooth pulp. So sometimes it is idiopathic. There could be no reason for no specific reason which we can identify. It is just inflammation. Most of the time the enamel wear off could lead to inflammation in the tooth pulp. At this point the pulp inside the tooth is swollen and there is no space, and due to this you experience pain. So here root canal treatment is the way to go if enough tooth structure is there. Then tooth decay, I have covered extensively about tooth decay in another video. You can check out tooth decay A to Z about tooth decay. And tooth decay, again filling can be done, or if it is too late then root canal is the way to go. Next, there could be some referred pain which is coming from the infections in your sinuses. There is a maxillary sinus, frontal sinus, and all those sinuses around the oral cavity, and that could be a cause of pain. Next is a dental abscess. Sometimes people come with a swollen face. One side is swollen, there is pain under the jaws, and inside there is a pimple kind of a thing on the gums. So these could be dental abscess. There are various types of dental abscess, we will discuss shortly. And finally there is cracked tooth. So in some cases, due to some trauma, some accident, or wear off due to age, tooth can develop cracks and it's not entirely broken. It's called cracked tooth syndrome. So there is a crack and directly cold and hot substances are going inside and causing pain. So here if the tooth is treatable, we go ahead and do a root canal treatment and try to save it. But sometimes we have to take a CBCT and identify if it can be saved or not, and if it cannot be saved, we have to extract and maybe go for an implant immediately. So these are the causes of tooth pain. So abscess, it was one of the causes of toothache. Let us discuss more about tooth abscesses. So it can, most common one is a periapical abscess. So at the base of the tooth, so in the signs of tooth decay, at the base of the root tip, sometimes you develop a big pouch of pus. This is nothing but dental periapical abscess. Here we can try a root canal treatment and antibiotic therapy, and we have to wait till the infection subsides and bone reformation, and then maybe go for a crown. So the next type is gingival abscess. So this happens due to some kind of food getting stuck in between the gums and putrefying and getting decayed over there over time and developing into an infection, gingival abscess. So again, root planing and cleaning, taking out the cause will be the ideal option. Here there is no need for any root canal or anything. So next is a periodontal abscess. So many a times the bone loss happens aggressively due to gum diseases, and there are pockets which are formed, and in these pockets you will see a bulge, and these are filled with pus. So here it could be due to the infection around the pulp, so it's called a periodontal abscess, and in most cases root canal is required, and most cases tooth will be mobile. If it is excessively mobile, very mobile, we'll have to take it out, wait for the infection to come down and place an implant, or we have to take out the entire infection along with the tooth and then immediately plan an implant as well. Finally, pericoronal abscess. So this happens at the wisdom tooth region, where the tooth is impacted and there is a lot of soft tissue trauma happening, and slowly it develops into an abscess, and at that time we can do a pericoronitis. A procedure is there to try to relieve it, but ideally it is recommended that you get out your wisdom teeth, get it taken out. That is the best option. So root canal treatment, which was recommended in most cases. So root canal treatment is nothing but removing of the pulp inside the tooth and filling it up with the medical substance called gatapacha, and then we seal it over there, and finally, as the tooth no more has blood supply, there is no nourishment, we have to protect it with a crown cap. So that's root canal treatment. So for most of the cases, there is a chance that root canals are painful. Patient complained of pain during the treatment and post treatment, and there is chance of reinfection. There is chance that you get your root canal done and caps are placed, and in future after few months root canal fails and tooth has to be taken out or re-RCT has to be attempted. So to avoid all those things, at Eledent hospitals we have lasers and microscopes. So using lasers and microscopes, when we do root canal treatment, that gives us 100% best results. Why, I'll explain shortly. So this is me performing a root canal treatment under microscope. You can, using that 25x magnification, I can see very clearly what all infected tissue is there, and I can visualize on the large screen as well on the TV. Even the patient can visualize. It's easy for us to explain what's happening, what's going on. Patient is also not blindly sitting, and he can see what is happening. And this is how lasers are used. So we put a small tip into the canal, we take out all the infected tissue from inside, and then we complete the total disinfection. So lasers have antimicrobial properties, so that causes total disinfection, and then we do a root canal. So in short, lasers and microscope help us get root canals in a very precise way with lot of precision. then these are minimally invasive. So because I have magnification, I don't have to dig the whole teeth around, so I don't have to make a well around it. I can make a small hole, get access into the canals, and with that small hole itself I can protect the teeth, not damaging it totally. That is minimally invasive. Using lasers, again, it has antimicrobial properties, so using lasers I take out all the infection, and then there is absolutely no pain, because lasers also help in stopping any kind of bleeding that can occur. And because of lasers and microscope we get improved outcomes, and that causes absolutely, I'll not say 100% but almost 90% sure that there is no chance of reinfection or re-entering into the root canals. And most importantly, the final one is patient comfort. So due to lasers there is absolutely no pain, almost no pain, and because of disinfection and shorter procedure, less invasive procedure, it is very convenient for the patients and they are very satisfied. So that is what I wanted to talk today about. So severe toothache, then please immediately go to a dentist, identify what is causing the toothache, what could be the possible treatment, get it thoroughly checked and get the right treatment done. So you can visit any of your dentist nearby, or I recommend please come down to any of our branches at Eledent, and we can do a thorough good job about it. Thank you.